This conference is building science in the hydration topic. Before this conference, very little research was known about nutrition, healthy hydration habits, and also about the relation of hydration to overweight. This type of conference is a good tool to make people from many countries interested on hydration and interested in nutrition interact and develop ideas of how to better promote at the public health level the nutrition science of hydration.
Following these hydration science initiatives, we then aware that what we drink actually impact our health, and not physically health only, but also our cognitive and also our mood, all impacted by the amount of water we take every day. So we now can see that if we drink less, then it will affect directly to our cognitive and our mood. And then if we continuing drink less, or so-called having the chronic mild dehydration, then it will impact our health, of course.
On one hand, it seems to be obvious that this is an extremely important part of our life, or our health status, our lifestyle, our diet. But probably in the last few years we can experience that there is more attention paid to this issue. And as we hear at this conference, this is not only about the hydration status, but the understanding of this whole hydration process, how it is related to obesity, how it is related to our healthy lifestyle and healthy aging, which seems to be very much on the top of the agenda of the international organizations as well.
I think it's very interesting to get different perspectives because we are usually working in silos. So we are very comfortable working in our own expert field. We all have our ideas, our methodology, and to have the opportunity to listen and to learn from our colleagues in different fields is very interesting because we can apply what they have been telling us to our obesity problem and see the way of tackling together by joining forces the obesity problem.
Sugar-sweetened beverage consumption has increased dramatically among children and adults in the United States and throughout the world, actually. As these beverages are targeted by public health promotion campaigns and then ultimately reduced, the question is, what are the optimal beverages to replace them? Many of the randomized controlled trials have compared diet or artificially sweetened beverages instead of sugary sweetened beverages and found weight loss. But that doesn't mean that these diet beverages are really optimal. They may be better than sugar sweetened beverages, but not as good as truly unsweetened beverages, the ultimate example of which is water.
There's no doubt that hydration has to play a very significant role in anything related to what we do in nephrology. We are specialists on water and salt, among other things, but the kidney is the vital organ that regulates our volume, and it does it by handling, among many other things, in particular water and salt. Hydration has been clearly identified as a major factor for kidney health, as I said before. Bad practices of hydration, especially in acute conditions, can generate disease, can generate stone disease and acute kidney injury. And again, more and more evidence is mounting, telling us that in the long term, if the practices of hydration are not reasonably well done, if they're not appropriate, there's a risk for disease in different forms.
The H4H initiative was very interesting in terms of putting together, bringing together the different specialists of hydration on one hand and obesity on the other, because we have so much opportunities to work together and to learn more from each other. And that's why I was very interested in participating on this initiative to share with my colleagues of the hydration field our experience and to have some lessons, very interesting lessons in terms of how to use the hydration as a tool to maybe to help to decrease the prevalence of obesity.
It's an evidence that convincing people to healthier hydration is a collective cause. It's a real strong and collective cause. By collective, I mean that not only us. It means the scientists, it means the policymakers, it means the associations. We have all the same goal, and this hydration for